Hi, everyone. I would like to welcome you to my topic today, which is what I will be discussing. This is going to be a talk on homeopathic approach to managing autism. My name is Dr. Rukshin Maste. I have done my PhD and MD in homeopathy. So let me take you on a little journey as to how I got into this field of research and how I started my study on autism, which led me down a whole path and which helped me explore the wonderful modality of homeopathy in treating these autistic cases. So, the first picture that you can see here is my undergrad college. Now, before that, a lot of you may already know that my father, Dr. Farooq Master, he is also a very well-known teacher and practitioner of homeopathy. And so I was pretty much born into this modality of treatment. I have been brought up and raised using only homeopathic remedies. I like to believe that homeopathy runs in my blood and it helps keep me going every day. And so it was almost but natural that, I was very interested, very inclined in this modality. And I wanted that to be the career that I chose for my future as well. And so I started my homeopathic college all the way back in 2005. And for us in India, homeopathic college and our homeopathic program is basically a 6-year program that we do, which involves hospital training, learning about regular internal medicine, that is the conventional part of medicine, as well as incorporating that into homeopathic medicine and practice. And so for us, we learn the regular anatomy, physiology, gynecology, forensic medicine, internal medicine, everything that you require to become a conventional doctor. But along with that, we are also taught organon of medicine. We are also taught every aspect that we know to become a homeopath. And so every year there's a half training given on conventional medicine, and there's the other half of our syllabus, which is homeopathic training. And so that really shapes us overall to be well versed in how to diagnose a patient, what we need to understand medically, as well as gives us the information on how to actually treat it homeopathically. And so after 6 years of studying homeopathic medicine, I then went on to the second picture that you can see in the middle, the brown structure, which was my college of MD. And this is where I decided to do my MD in pediatrics and homeopathy. Now, my research during this was I wanted to study about respiratory medicine in pediatrics. And so I decided to do my majors in that. This was another 3-year program. Along with that, I was also assisting dad in his practice. I was also going to hospitals, getting training, getting more clinical exposure to how to be a homeopath. And so the next 3 to 4 years just went in understanding this aspect of homeopathy. After which, very coincidentally, I started going and training under a conventional pediatric neurologist who was one of the very famous pediatric neurologists that we had in Bombay. And I would visit her clinic every week, and we would land up seeing loads of cases of autism, ADHD, genetic disorders, epilepsy, convulsions, and all sorts of genetic and neurological complaints. And this really got me very interested into the topic of autism. I started going back, I started looking at literature, I started seeing the research that was going on, and I just found very few people who were really working into this topic at that point of time. So I decided that since my passion was pediatrics, I wanted to then do something more with autism because of just the sheer inclining rates. Every other child that you would meet would be autistic in some form or the other. And homeopathy, I knew, had an excellent scope with that. And at the same time, I was also exploring doing my PhD. And so I decided to combine the two. And I was like, let me do my PhD, but let me choose my topic as the study of autism. And so the picture that you see down on your left is the hospital, which is Jarbai Wadia Hospital, where I decided to do my PhD. This is a conventional hospital. However, we do have a homeopathic OPD that they allow us to run in this hospital. And so using the setup of the OPD, I decided to do the clinical study. We got the ethics committee approval, and we were good to go to start off with this placebo-controlled single-blind study, which went on for about 2.5, 3 years, which helped me compile a lot of data and actually immerse myself into understanding what autism was all about. And so from the Homeopathic University, which was in Jaipur, which was giving us PhDs at that time, I started doing my PhD research. And eventually, just through COVID, I gave my exam, got through with my PhD, and then life got me to Singapore. So that's where I am right now, currently living, practicing in Singapore, seeing a lot of patients here. I have a huge pediatric practice. I have a lot of autistic cases as well now. And carrying forward the steps of homeopathy, though homeopathy is not very big in Singapore, trying to make it as known as possible to the population here. And so let me start you off a little bit about the study first, and then into understanding autism from the study. So this is again a photo of the Baijar Baiwadia Hospital, which is present in Mumbai. It's a very, very famous and internationally known institute for the work that they do in pediatrics. And so it was a very prestigious hospital for me to do my PhD work on, especially with homeopathy. Now, we all know about autism, so I'm not going to get into it too much. I'm not going to get into the statistics. We all know that almost 1 in 50 children now is diagnosed in some form or the other with autism. We'll just go very superficially through a little bit of the characteristics of autism. So this is what WHO tells us, which is persistent deficits in social communication and social interaction. We see a lot of restricted behaviors, a lot of repetitive behaviors. There are patterns of behaviors or activities that we see in these children. And symptoms cause clinically significant impairment in their social, in their occupational, and in their other important areas of current functioning. Now, there might or might not be intellectual disability or a developmental delay that we may see with these children. Now, the reason why I have put a rainbow at the background is because that's what autism is. It's a huge spectrum. There's some children who lie on this part of it, and some children who lie absolutely on the opposite part. And there are lots of them that just lie somewhere in the center. And so it's important for us to first understand where these children are being placed for us to really be able to help them further. Now, again, causes is something that we all are pretty much well aware of as holistic practitioners. I will go through it very quickly. A few causes that I believe should be given a lot of importance is the fact that most of our food is now genetically modified. A lot of the nutrients that we would get from food even 20 years ago is not what we are getting now. Currently, what we are putting inside our body is more food-like substances than actual food. Continuous expansion of course, the mandatory vaccination schedules that's going on all over the world. Environmental toxicity is a big thing. It's a big thing all over. I notice it's a big thing here in this part of the world as well, with the constant spraying of pesticides that happen, with the constant spraying of the produce that happens, and with absolutely no idea of how that is impacting our health. EMF is a problem which, again, all of us are facing with this day of communication and technology. A lot of increases in pregnancy resulting from ARTs, which is your IUIs and your IUFs, the hormones that we are putting inside our body. We don't exactly know what that is doing. So, for example, the normal fertilization process that takes place in about 5% of oxygen in the environment. Whereas when you're doing an IVF, there's almost 20% of oxygen which is coming in the environment. And so we don't know how that is impacting the fetus. A lot of reliance on powerful antibiotics, a lot of us facing antibiotic resistant infections, excessive reliance on pharmaceuticals during pregnancy. I remember that there was a time when doctors would advise us against so many medications during pregnancy, which now currently are very much acceptable. First, they wouldn't allow you to be on antidepressants, medications for your anxiety. Now, certain medications in low doses are still being allowed just for the sheer reason that patients cannot function without these medications in their lives. And so we don't know again what impact that is having on the children. And the digital dystopia, right? So our kids, and I see this again in this part of the world as well, where you would see kids as little as 6 months, 8 months, 10 months, who would be put into strollers, taken into malls, given an iPad so the parents can continue to, do their daily day-to-day routines. And the kids are given these iPads to watch, which is having a massive impact with the EMF, with what impact it's having on their brain, on their cognition, in how they are assessing and sensing the world around them. And this, I believe, could definitely be contributing to the causes of autistic-like behavior. So let me get on to the study that we did. Now, this was a single blind, randomized, placebo-controlled study all we had to do was we had to divide the participants into two groups. One group would be given homeopathy, the other group was to be given placebo. We were going to observe each of them for 1 year, starting from the time that they started the treatment. And I wanted to follow up with them every month. So this is how we randomize the patients. And so there's this randomization table that we take. We decide that every odd patient would receive a homeopathic remedy and every even patient would receive a placebo. And so you start with any point on top of the table. So as you can see, number 1, which is circled up, you start from there. And so the first patient, which is number 1, so they would be odd, would receive the homeopathic remedy. The next patient would be number 9, which would also again receive the homeopathic remedy as it's an odd number, and so on and so forth. And at the end of it, you get an average number of patients who receive the homeopathy and average who get the placebo. So we started with a group of 92. We had approximately 10% of the participants who had to drop out for various reasons. And so at the end, we were left with 84 children, of which half of them, 42, were homeopathic and half of them were the control group. Now, the reason why it's important to have a control group is for us to really assess how well did the homeopathic group do. We wanted to do a double-blind study because that is the hallmark and, the gold standard of research. However, because homeopathy was so new to this university, we had a whole ethics committee of about 30 members, I remember, who were sitting and just asking us question on question on question, because they had no idea about what a homeopathic study was, what homeopathic remedies were. They, of course, didn't want to endanger the life of the patients coming into the hospital in any way. They had certain ethical considerations to maintain. And so after a lot of explanation and, explaining to them what homeopathy was about, did we get the permission to do the study? And so we definitely did not get a double-blind study in. It was only a single-blind study that we could do. And so this was the inclusion criteria, which is the child should be diagnosed by a neurologist as having autism using the CARS scale, which is your childhood autism rating scale. These are all international scales that we had to use. The age was between 2 to 10 years of these children, and we included both the gender. What we did not include in the exclusion criteria was children with any kind of comorbidity. This was more for ethical reasons, as if they belonged to the control group, we could not put them only on placebo. And so children with tumors, with cerebral palsy, with hormonal disorders, any kind of infective pathologies like coexisting mortalities like tuberculosis or any other organic disease was not allowed to be part of the study. And of course, those who could not adhere to the follow-up schedule. Now, the only thing that we allowed in both the groups was therapy. And that was something which, again, the ethics committee did not want us to stop. We found it very unethical to stop therapy for children in the control group who were anyways not getting any medication and would lose out on that, peak time to be able to recover from the autism with the therapy. So that was on in both the groups. So it did not interfere with our statistics at all. So the diagnosis, all the cases were confirmed using the SCARS test that I told you about. The case taking was thoroughly done in a very classical way. It was always a 1.5 hour case taking. We inquired about everything, starting from the mother's history during pregnancy, starting from how the child was conceived, how the child was born, how the child grew up, the milestones, at what age and at what stage did the mother start noticing that, things were not seeming completely in sync. All of this becomes very, very important when we're working with autism. And I'll explain to you a little bit about it when we discuss a little more. The totality of the symptoms was formed using the peculiar queer rare strange symptoms. So we had to find out these PQRS symptoms, which in an autistic case becomes very challenging, as most of the times they present you with only the symptoms of autism, and there's rarely any symptom of the patient to really take in your totality. And so it takes a lot of skill to be able to dig deep enough to really get those patient symptoms. Repertorization, we use the synthesis repertory. The remedy was selected after that based on the knowledge of our materia medica. Some questions that we covered during this case taking was any kind of unusual behaviors, any unusual interests. So generally, and again, this is quite commonly seen with autism, right? That they will have some interest that, fascinates them, something that they want to do all the time, something that makes them happy. And so with some people, it was music, and with some children, it was drawing, and with some children, it was simply just going and watching animals or being with animals. And so all of them had these peculiar interests, which became very important to us in our totality. unusual obsessions, their taste preferences, of course, their aversions, fears that these children had. And some of them were very unique and so formed a very good totality for us. Any kind of triggers for their stress and their anxiety, then how they would react to these stressful and anxious situations. What were their calming patterns and, how did they cope with this? What made them happy? What were their happy zones? Pregnancy history thoroughly taken physically and mentally. Vaccine reactions, which a lot of the time we noticed that also the study was done in a very low socioeconomic group. And most of the times, these parents were not present in terms of they had to work for a living. So both the parents would be away, leaving the kids with either the grandparents or, anyone who would take care of them. And they weren't very observant with a lot of these reactions, which became quite a hindrance for our study. But vaccine reaction in general is a very important aspect to understand and learn. Also, when you're prescribing later, and we'll talk about the vaccine remedies that we can use, it's important to know which vaccine was the one that triggered these set of reactions and the physical symptoms which these children experience. So a lot of the times, the common physical symptoms we landed up getting was allergies, tendency to catch recurrent coughs and colds. A lot of them had respiratory related symptoms. I would say a large chunk also had a lot of gastrointestinal allergic symptoms. So, like indigestion or foods wouldn't suit them, gluten wouldn't suit them. And so, the very observant parents would come and actually give you these kind of symptoms. So, it's important to understand those symptoms as well and take them in your totality when you're studying the case. Now, these were the common rubrics. And so, these are just the rubrics of autism, which were present in a lot of the cases. I'm not saying that we used them, but it's important to know these rubrics when you're studying autism. So, mind absent-minded, absent-minded children. Abstraction of mind is again something that we use when, the mind is completely not present. Autism, autism in children. Change aversion to in children. This is again something we very commonly know that for autistic children, it is very difficult for you to change their routine. They're very set in their patterns, very set in their behavior. You take a different path to get them from school to home, and it can totally shake them up and disturb them. So for that, we take the rubric change aversion to. Company aversion to. When they like to be alone by themselves, don't like to interact with other children. There is that social awkwardness. Rubrics like this can be taken. Development of children arrested. Development of children arrested, their mental development. Development slow. Expressing oneself cannot express oneself. Expressing oneself becomes very difficult. They are constantly absorbed in these fancies. Speech is affected. Speech is inarticulate. Then a lot of the times mothers would come and tell you, right, that we have, our child who absolutely shows no emotion towards us. So the mother could be crying in one part of the room and the child would feel nothing, would be absolutely unable to understand the emotions that the mother is feeling. And so in those instances, we can take rubrics like unfeeling family with his. Then in mouth chapter, speech indistinct or speech wanting, when there's no speech at all that the child has, we take speech wanting. And general's restlessness. I have not mentioned every rubric, but again, another rubric that I just thought of was, which I landed up taking quite a lot, is impelled to touch everything. And so you will see a lot of the kids who will come to your clinic will want to touch everything around, will want to examine, put everything in their mouth. There are specific rubrics that we have for that as well. Now, some of the common remedies that I landed up using in the study. And so at that time, which is, I would say, about 6 years ago, my understanding of autism was this much. And at that time, I felt best to use just the approaches that I was comfortable doing and what I was taught at that point of time in my study. However, I feel like since I did the study, my understanding now has increased quite a bit. And so if I were to do the study again, I am sure my approach would be different for every case. And so I will discuss those different approaches with you also later. But during the study, I went through a very classical homeopathic phase. And so all I wanted to do was study the case classically and prescribe on that. And so most of the cases landed up receiving carcinosin, tuberculinum, natrimur, tarantula, cupromet, saccharum officinalis, medorinum, or a baryta carb. There were a lot of other remedies used as well, but these were the most commonly used ones. At that point of time, I was using only a single remedy, and I still do. So single remedies were used. Started with a low potency, like a 30C. However, now I feel like I use 30C, but I also start with LM potency sometimes. How was the remedy repeated? We had a set pattern. If there is no change in the symptoms or if the patient is completely status quo, we retake the case and see if the remedy still covers the case. If we have the same totality, then we reconsider the posology. So we would go up a potency. So we would change the potency, or we would change the repetition of that same potency. If we feel the totality had changed and, we missed out on something, or, generally in the second or third follow-up, parents observe more, they come up with a new set of symptoms. And so we feel a remedy is completely different. We would immediately change the remedy and move the course of the treatment. However, if the patient was better, we would decide to continue medication in the study group and continue the placebo in the placebo group. So the ATEC score, this was a score that we decided to do every 3 months. And this gives us an idea of how the patient is progressing every time that we see them, which gives us an idea as to how the treatment is working on the child. And we had a psychologist come in to do the CAS score and the ATEC score. The CAS score was only done in the beginning to diagnose the child and was done towards the end when we completed the study, so the 12 months of treatment. The ATEC score, however, was done at 0 months, 3 months, 6 months, 9 months, and 12 months. Now, the ATEC score is something that ranges between 0 to 180. The higher the score is, the more the degree of autism. The lower the score is, the better the child is and the more normal behavior that you would expect from him. So we started with a mean score of 83. We ended the study with a mean score of 71. Now, this was a comparison between the study group and the placebo group. So the study group is the blue line that you can see. As I said, we started from 83, went down to 71. However, the placebo group had a mean score of 70.95, which went down to 67.31. Now, you have to keep in mind that therapy was on, right? So we do expect that even the placebo group will show us some form of improvement. And comparing both the groups now, you can see that the study group went down by almost a difference of 12 points, whereas the placebo group went down by a difference of 3 points. So it's very easy to tell, just looking at this one graph, that there was a significant amount of benefit that homeopathy was giving these children. Now, this was the CAS score again at the beginning and end. The blue line is the study group. So it went down from 32 to 28, almost a 4-point. And whereas the placebo group went down from a 31 to a 30, which was just 1 point. Now, with CAS score also, it is a range which goes all the way from 15 till 60. If the child is in a score less than 30, the child is not considered autistic. A score between 30 to 36.5 is considered mildly autistic or moderately autistic. And then above 37 to 60 is the severe forms of autism. And so while we were treating these children, we noticed that most of them were in the mild to moderate range of autism. So these are a few of the approaches that you could take to treat a case of autism, and I'm going to discuss them actually in detail later. So let's go on to the top 10 things to remember for a successful approach to cases of autism. First, to understand what are the symptoms to take in your totality, it is important to know what are the common symptoms. So you have to first understand what is autism, what are the normal symptoms of autism. Is touching things a normal symptom, or is it something that's, peculiar to a child? Is hyperactivity a normal symptom, or is it something that's peculiar to a child? And so to understand what's abnormal, it's important first to know what's normal. So learn that. Pay a lot of attention to first understanding the disease in detail that you're going to treat. Keep a keen sense of observation. Now, with all diseases, but in autism in particular, you have to take most of your symptoms through observation, because this is not something that parents will come and tell you that, this child does this or this child does that. When you observe that child in your practice, and no matter however, the degree of autism he has, I always like to have the child in the cabin doing, his normal behavior through the course of the consult. So I can observe exactly how this child is behaving, how this child is responding. When the parents talk to the child, is he having this eye contact? Is he not having that eye contact? Every single thing has to come from observation when you are dealing with this. So keep a keen sense of, paying more attention to what you're seeing than what you're hearing. Make sure your initial case history is as comprehensive as follows, because a lot of the times in the follow up, it becomes important to know what existed before, to know what's actually getting better, or to actually work on what's not getting better. Familiarize yourself with all the different modalities available to treat autism. So when the patients come to you and the parents talk about, the child requiring going through a particular kind of therapy or going through a particular course of supplements, make sure that when you are talking to them and they give you this information, you're aware of all of this and you're not, you don't have a clueless face where they feel like, you're a practitioner who isn't even aware of the ongoing treatments that are available for autism. So it's important to know all the different modalities that other practitioners are using. Analyze the case in detail, and you have to see what modality works best at that time. I feel like there are so many options available now for parents of autism, and the field has really progressed a lot, I would say, just in the last decade, where there's so much more awareness. There's so many different types of treatments that have come in for people to explore, and all of them have so much benefits for the child. It's important to know which modality works at what stage in the autism. Make a list of all the remedies when you see that child as to what you feel you will need through the course of the treatment. So what acute remedies you feel this child may need? What are the constitutional remedies that are coming up in your repertorization? Which nosodes do you feel like this child may need at any point? Or what is the anti-miasmatic remedy that you feel a child may need should you get stuck and you want to use an intercurrent remedy? At that first consult, when you have so much of information, it becomes very easy to jot down your plan. So in the future follow-ups, you can always refer to that and get an idea of what your thought patterns were. Have a heart-to-heart with the patient and discuss what you plan on doing without over-promising. And I know a lot of us are very empathetic to a point where we want to do our very best. And so we want to commit that we will be able to do a lot for the child. But I always feel like it's better to, under-promise and over-deliver rather than disappointing the parents with, your treatment. Keep yourself updated with all the newest research. And again, research is something that you have to be on top of, whether you're in the research field or not in the research field. As a practitioner, research is important. Knowing what works, when does it work, to what degree does it work is very important, as it keeps your work more scientific. Be patient and know what to look out for and how to manage a follow-up. Again, you go back to Ken's 12 observations. So you need to know that once you give your remedy, what are you expecting? If you're absolutely clueless about what to do after giving a certain remedy, it will muddle up your case and muddle up the picture, and you'll, most likely make a mess of it. But if you are very clear that, okay, if this symptom comes up, this is a good sign, or this symptom is a bad sign, this is what I need to do as my next follow-up. Things become much easier when you know when to change a potency, when you know when to change a remedy, when you know when to absolutely do nothing and just wait and watch. All of those things are very important when you're managing these cases. And the last one is, don't overcomplicate things, keep it simple. Autism for a lot of people seems like a very strange land to kind of overcome, because just for the sheer reason that, there's so much information out there, the cases seem very difficult to treat. But I feel if you just stick to simple rules, simple principles, treat it as you would treat any other case, it can actually give you results pretty well if you keep it simple. So let's discuss a little bit about the different approaches that we use. And as homeopaths, I feel like whether you're a classical prescriber, you're a sensational prescriber, you're using whatever method it is that you work with, it's important to know the approaches which are out there. Which one you want to use is completely on you, completely on the knowledge that you have on that topic. But at the same time, it's important to know what's available at your disposal, should you choose to use it. So now, Unda remedies come up as quite a preferred mode of treatment when you're dealing with autism. And so these remedies pertains to the undulation of energy and they were designed to optimize the body's ability to be able to expel toxins and wastes. Now, one of the most popular theories around autism is that these children have loaded up their bodies with toxins. Now, this can start all the way from pregnancy, from the health of the mother and the toxins that were circulating in her system, which she unconsciously passed on to the child. Or it could be something that the child ended up accumulating due to the exposures that the child had with the environment, with what was put inside the body, medications, vaccines, etc. And so these children lack the ability to detox these toxins. So generally, we're provided with a very well-functioning detox pathway. So our kidneys, our livers, our spleen, all of them are good detox organs. And when they're functioning properly, no matter what you put into the system, the organs can detox, get rid of it, and everything's fine. However, when we cannot detox it and when there is some irregularity in these pathways, that's when there is an overload of these heavy metals or toxins that accumulates in the system. And this is something that is very well researched on and seen in autistic kids more as compared to other children. And so we definitely know that there is that increased burden of toxicity with these children. And so what Unda Remedies does is it clears out the pathways for the body to detox these remedies. So what it does is it removes them from the cells and it excretes them from the body. Their focus is particularly on strengthening the drainage functions of the liver, the kidneys, and the lungs, which is of course very valuable when we're dealing with cases of autism. Dixon Thorne, who was one of the foremost teachers of drainage therapy, compares the actions of Unda Remedies to washing and repairing the walls before painting them. So according to him, he's like, first clean up the picture that's already there before you introduce anything new into the system. So this is just a photo that I've put up for you to know what Unda remedies look like. And so this one, for example, is Unda remedy number 1. And so this works on the liver pathways. And so you will see the herbs that are there down, and the remedies are all mostly the ones that we use for liver-related complaints, which is your millefolium, uva ursi, valeriana, angelica, equisitum, lycopodium, terebinthina, and argentum metallicum. And you see all of them are very low potency, so 4x, 5x, and a 12x. And so these remedies are those which promote these drainage pathways. A lot of homeopaths who work with autism like to start the case with Unda remedies before they actually go ahead and prescribe any constitutional remedy for the children. Now, Banerjee protocols is something most of us are familiar with. And so this is the protocol that he gives us for autism, which is to start off the case with an Ethusa 200 every third day, along with Calcarea Phos 3x every day, 2 times a day, and Hyoscyamus 6C, again 2 doses every day. And do this protocol for 3 months as the first line of treatment. If you feel like symptoms are returning, go to the second line of treatment, which is your Carcinosin 30C, 1 dose every alternate day, and continue with the Calcarea Phos, 2 doses daily, 1 in the morning, 1 in the evening. Along with this, he asks you to take the Brahmi mother tincture once a day. Now, do this for 3 months. If this also brings back the symptoms and they don't really improve the way you want them to, go on to the third line of treatment, which is your Stramonium 200 every alternate day. Continue the Calcarea Phos 2 times a day, and then introduce Chamomilla 30s, 2 doses daily. Now, what I personally don't like with the protocols is the fact that, it generalizes. And we all know, especially with autism, every single child is so different. Out of all the 84 children that we saw in the study, you could probably see some symptom similarity with a few of them. But otherwise, there was that aspect of uniqueness to each of them. And I feel the beauty of homeopathy is to appreciate that uniqueness, to understand that uniqueness, and to actually use that uniqueness to our benefit for us to be able to prescribe to them. And so this is not something that I have ever used, but just for your information, it's important to know that there are protocols like this that you can also try. Now, another very commonly used method is the never well since method. And that goes back to something which Dr. Hahnemann introduced in his organon, which was your ailments from, right? And so he said in every totality, the importance or the number one thing that you need to consider is the ailments from, which is what caused the symptoms to start. Now, that can get a little tricky. You don't always, understand what causes these symptoms of autism. No parent, comes up and tells you that, this is what happened. And the next day, we realize that our child is autistic. No, it's a very slow progression that you see. But I feel like when you carefully take a history, you can narrow it down to certain events. And so after taking a couple of cases, you will also be able to kind of understand and realize what to ask the parents for exactly to help narrow down this never well since. So the name suggests what the method is all about. In this method, the study is based on recognizing and addressing the event or the intervention that occurred just before the onset of symptoms of autism, or the appearance of a developmental regression, or the halting of a normal developmental process. And so we see this very often with autism that, the mothers say that my child was absolutely fine, had already started speaking, had already started walking, had already, started doing a lot. And then suddenly there comes a point when things start regressing. And so it's important to understand that period in between as to what happened emotionally, what happened in the family, did they move, did something change, did the environment around them change, did some help that was coming into their house change. It could be a lot of factors which, when you keep inquiring, you will somewhere come up with an answer that really helps you prescribe with this method. Now, once the event is isolated, it can be addressed with homeopathic remedies. And a lot of teachers of autism believe that this layer has to be addressed before you start with any constitutional treatment. And the remedy that you'll end up giving most of the times in this method is a tautopathic remedy. Now, tautopathy is derived from a Greek word which basically means identical. So we believe that whatever it is that caused it, we make a remedy from that very same substance, and that's the substance that's given as a remedy to the child. And we believe that that helps remove the layer that this particular substance has caused in this child. And once that layer is removed, then it is easy for us to give the constitutional remedy and start off with the treatment on that path. Now, cease therapy is something which most of the autism practitioners will be very well aware of. It was started by Tinnis Smith. Now, this is a 4-potency detox protocol, and it helps clear out again layers of vaccines and medications which have been used for these autistic children. So his method uses vaccines and medication nosodes in escalating potencies 30, 200, 1M, and 10M. So generally, you would have the remedy made from the very same substance or vaccine, and that would be a remedy that would be given. The clearing begins with a 30C, and you start off with the most recent layer of suppression that this child has gone through, and then work your way down. So examples of remedies that you would use would be oxytocin, lac maternum, placenta, vernix gaseosa, cuprum cum carcinosin, sacrum officinalis, just to remove the layers that this child has been exposed to. Now, to become a cease therapist, there is a particular training that you need to undergo and learn the method correctly before you start using it on your patients. Now, matridonial remedies is again something very commonly used by practitioners when we're working with autism. And the reason being that we give a lot of importance to the child and its state when it was in the mother's womb. And so, of course, we will as homeopaths inquire into the symptoms as well. And then certain cases require those very same substances as remedies. So matridonial remedies would be remedies like placenta, would be remedies like human milk, would be remedies like the umbilicus, would be remedies like the amniotic fluid. And there are different indications that we can use these remedies for. Now, when I started my study with these autistic cases, there was a Dr. Praful Barwalia, and he was doing a lot of research work in this aspect of autism. And I believe he was one of the pioneers for starting off research in the topic of autism, especially around the locality where we were. And he has his own institute known as the Spandan Institute, where he conducted multiple studies to see if children are benefiting with the homeopathic treatment. And again, his work was very scientific. It's been published. And again, he saw that children were improving very well with homeopathic remedies. And he found that he could group these remedies into different aspects of the patterns of autism that you would see. So, for example, there would be some children who he felt were more regressive. And so, in that case, he felt like remedies like Baraita and Zinkum work very well. Whereas some children have more sensory issues. And so, with them, he found remedies like phosphorus, china, and Nux vomica working very well. Another set of children that he felt were more kinetic in their behavior. With them, he noticed stramonium, tarantula, cinna to be very useful remedies. And then remedies which covered all of these aspects of children and which he used in all the three different kinds was carcinosin, natrimune, medorinum, and tuberculinum. And so he called these four his core remedies, which he landed up using in most of the patients. And so again, very strangely, these came up very commonly even when we did our study in the hospital as well. And so a lot of the times when we would form totalities with even the PQRS symptoms of these cases, these remedies would be the ones that would come up very highly and show the benefits in the consequent follow-ups as well. Now, of course, constitutional remedies becomes a very large part of the approach that we use. I do have a lot of symptoms that I see coming up with constitutional remedies, which I have material for, but I won't be able to discuss that in this limited time. But with carcinosin, with natrimune, with pulsatilla, there is those certain set of autistic symptoms that you keep noticing. And once you do land up prescribing it, the next patient, when you see a similar set, it becomes very easy for you to catch these pictures of constitutional remedies. Now, what happens with constitutional remedies is, and this is something I only learned with trial and error, is that sometimes the body is not ready for it. So oftentimes I would notice that I would be studying the case and I felt like I was doing a great, analysis, the totality, the remedy was completely covering the picture of the totality. But for some reason, it would aggravate the child. For some reason, it wouldn't work as well. And that's when I realized that sometimes it becomes important to use the constitutional remedies a little later in the course of the treatment and start off with another protocol before the body is actually ready to accept these constitutional remedies. And so while I would use them in all my patients, just the timing of using it is something that I learned to work around as to, when it would be the ideal time. Bowel nosodes is something I use in all sorts of patients. When I see allergies, eczemas, constipation, gut issues, for everything, I'll end up using bowel nosodes in some form or the other. So again, they become a very important way of treating when we are working with autism cases as well. I don't expect a bowel nosode to treat autism, but I do feel like at some point it is a good idea to intervene with these kind of remedies in between, constitutional treatment or in between when the patient is showing up with a symptom. And the last thing is anti-miasmatic remedies. A lot of homeopaths who work with autism like to start the case again with an anti-miasmatic remedy. So they'll open it up with a syphilinum 1M or they'll open it up with a medorinum 1M, do 1 or 2 doses, wait for some time, and then start off with the other remedies that are coming pretty clear with the case. And so that's another approach that you could consider at starting your case, or you could consider it as an intercurrent when you feel like things are stuck and not moving and you're sure of your remedy and you want it to work. So you can use the anti-miasmatic remedy as an intercurrent at that point of time and then follow it up again with your constitutional remedy. And most of the times that lands up working pretty well. Now, some things that you need to remember when you are working with autism is that when you get a follow-up, what do you do? What do you expect? What are good signs? What are not good signs? Now, in general, of course, amelioration of the symptoms that the patient came to you with is a very good sign. But that is something that you'll end up seeing a little later on in the course of the treatment. What happens a lot of times is that the child comes up with acutes. And this is very important to understand, not from the perspective of only autism, but just in general when you're working with homeopathic remedies. And so there can be certain signs that the body will throw out when it is trying to improve its level of health. whether it be getting a fever, whether it be producing some sort of discharges. And this is all very explicitly mentioned in our organon of medicine as well. And so when these reactions occur, it is important to educate and to tell your patients not to suppress these symptoms in any way, as suppressing them will only push us back in our course of treatment. And so when the patient does experience these symptoms, it's very important they come back to you. You analyze the case, you give them an acute remedy if you need to at that point of time to be able to give comfort and relief to this child, but try to avoid any suppressive measures at that point of time. And that becomes very, very important for every kind of condition that you're working with. So when there is a fever, when there are discharges, explain to the patients how this is a good sign that the body is actually showing a reaction to the remedy that we have given them. Again, a very important thing to remember is that when you do get follow-ups and feedback from these patients, don't expect that within a month or two there's going to be drastic changes. Remember that these cases have most likely had these symptoms for 2 years, 3 years, 4 years, depending on when they come to you. I get a lot of teenagers as well who are quite severe cases of autism, honestly, and parents have tried every modality and they come to you very, very desperate to search for answers, to be able to provide some form of relief to their child. And remember to be slow and steady with your treatment. I don't believe in treatments, where we go very aggressive with the potencies, where we try to introduce too much too quickly to be able to see very quick reactions, where within 1 or 2 weeks you're expecting symptoms to come and go. No, it doesn't work that way. It's important to be patient. It's important to understand that the body takes its time to heal. There is a lot of inflammation in these children. There is a lot of gut dysbiosis in these children, and things like that take weeks and months to heal till you can actually notice favorable symptoms, until you can actually notice symptoms that are ameliorating with your remedies. So be very patient in your approach. Be very patient when you're dealing with these patients. Explain to the parents as well why they need to be patient, and then take the case slowly ahead from there. So this was my little introduction to you on how to manage autism in your practice when you get patients. And I hope this was beneficial. The study was, as you saw, very impactful. It was very positive in its results. And we were definitely very happy to show the institute there that just within a short period of a year, we were able to improve the quality of life of these children. A lot of them had no speech when they came to us. They started speaking slowly in monosyllables. A lot of them were able to sit through therapy, which is a big sign. A lot of the times, mothers will come and tell you that, my therapist has said that since we started homeopathy, he is able to sit through the therapy session, which then has such a better impact on this child to be able to vocalize, whether it be speech therapy, occupational therapy. And so it's important to notice these little key signs that the parents will give you to tell you if you're on the right direction or not. And so we were very pleasantly, of course, happy with this study that we did. And since then, as I said, my approach has changed. I do land up using different methods. Along with homeopathy, also, I feel like these children need support. So I wouldn't encourage homeopaths to believe that it's the only modality that we use when we are working with autism. Therapy has immense benefits and is very, very important for the children to undergo along with your treatment. I also believe that we have to focus on the gut. There is definite gut dysbiosis. Studies have proved that time and time again, that their microbiome and a normal child's microbiome is very, very different. And so we need to regulate that dysbiosis. For that, bowel nosodes work very well. Our constitutional remedies work very well, but also to a certain extent, when you need to introduce probiotics into this child, they also can be very beneficial. So you must keep an open mind to those modalities as well. A lot of them are lacking in vitamin D. A lot of them are lacking in magnesium. So it's important sometimes to substitute it with good quality supplements with this child. And I believe that the work has to be overall, even nutritionally. It's very important that we control the inflammation that their body is undergoing. At the end of it, it all boils down to the child's body being chronically inflamed. And so to bring down the inflammation, a good healthy diet, a diet which is rich in fruits and vegetables and meat and eggs, low in any kind of processed food, absolutely no sausages and no impossible meats and things like that. We need to educate parents with a lot of that. Now, with gluten and lactose, everyone knows, okay, be off gluten, be off this. But there's a lot more that goes into nutrition with an autistic child than just being, off gluten and off lactose. And so it's important to work with the right therapist who can advise you with these aspects as well. And so when we target the disease from all of these different modalities, I've noticed that treatment can be much faster. It can be beneficial because we're working at many layers at the same time. And so we're trying every aspect that we possibly can to work on these children. And the golden age is to try and do it as quickly as possible. So the younger the child is, the easier it is to fix these neural pathways, the easier it is to control the inflammation, the easier it is to get the speech back, the easier it is for them to be able to function as normally in a society or go to a normal school and things like that. So use everything at your disposal. And I wouldn't agree with the homeopaths who decide to, just stick to one modality and one modality alone, because every modality has such a big role to play. And we should give the child the maximum chance that we can to be able to recover. So this was my little inputs on how you can manage autism. If there's any questions, if there's any queries, if you would like to have more statistics and more details of my study, please feel free to email me on my email address, which I have mentioned here. You could also check out my website for more contact details and information, and you can stay in touch with me through there. Thank you very, very much. And I hope to see you all again. Take care.